if you have hypertension, hypotension, your pulse runs high, your pulse runs low, you need to be checking your blood pressure daily. Before you take your medication, you need to check your blood pressure. You need to ask your doctor if they have prescribed you of any cardiovascular medication for parameters. When should I not take this medication? 10 times out of 10, they're going to say, hey, with this specific medication, if your heart rate runs this, if your blood pressure runs this, do not take it. Hypertension medication is to bring your blood pressure down, right? If your blood pressure is already within a certain parameter, then you do not need to bring it down even more, because that's going to cause you to feel even sick, like feel worse, right? Same thing for hypotension. If this medication is to bring your blood pressure up, but your blood pressure is already up, and you take this medication, it's going to still do what it's supposed to do. It's going to bring your blood pressure up, right? So you need to ask your doctor if they have prescribed you medication for hypertension or hypotension, for certain pulse ratings, what the parameters are for you to take it or for you not to take it. Just simple. What are the parameters for this medication? They know what you're talking about, okay? A lot of times I'm seeing my patients and they've taken their medication without actually seeing what their blood pressure was prior to, and it is causing them to feel worse, right? Some common signs and symptoms of hypertension, that means your blood pressure is high, is severe headaches, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, or even chest pain. Hypotension, right, is some signs and symptoms that you will see is some lightheadedness when standing from sitting or laying position, unsteadiness, dizziness, weakness, blurred vision, fatigue, and fainting. As you can see, some of the signs and symptoms for hypertension or hypotension are similar. So when you're experiencing these episodes, it is important for you to check your blood pressure. That is going to be important. It is important to know when should I when should I not take this medication, okay? If you're already on these medications, you can still change some things, right? You can still change your diet. It is encouraged for you to walk 30 minutes a day, right? No added salt. Do not add additional salt to your foods if you have hypertension, and be adequately hydrated. You need to drink your water. A lot of times when I see my patients that have hypotension, their blood pressure is really low, I will say, hey, let's go ahead and drink a bottle of water before my visit is over. Their blood pressure has already went up. Same with hypertension. You want to make sure that you are drinking enough water, okay? Well, that's all I got for y'all. I pray that helps. Of course, no additional salts, low sodium. I am not a medical doctor. Do not take what your doctor is telling you, but definitely ask for parameters for your medication. Definitely keep a blood pressure log. Definitely invest in a blood pressure cuff. The one that goes across the arm is the absolute best one, but you can get the one that goes on the wrist for those of us that have the smaller arm, so it doesn't necessarily fit the best. I might make a video on how to put that on properly, but typically on the one with the wrist, you want to have the monitor part here, and then you want to just kind of place it above your chest like this. All right, there's too many people that I'm seeing with these hypotension, pulse issues, and they're not considering the fact of taking their blood pressure prior to, or even monitoring their blood pressure with a log. That is going to be crucial when you have any type of blood pressure issues, okay? Amazon or